Today my topic will be on materials used for medical applications, and in this topic I am trying to cover the basics of materials so that the master level students will be benefited, and those who are in the initial state of doing research in the medical field, they will be helpful. They will be getting helpful in this topic. And so in every day we are using different kind of materials, starting from households. We usually call it by a name like a cup or a wooden door or a spoon, like that we usually call it by a name. Actually they are made up of different materials, and we generally we can differentiate between metals and non-metals, and sometimes some of elder people can differentiate a polymer and a plastic or rubber kind of thing. So this is the general knowledge about the materials for the layman. This is the same introduction for medical applications also, where we can identify some of the medical devices, like this is a plastic or a glass or a metal kind of thing. We can have a general knowledge about this.
If you can
yes,
kindly make it as a full screen. I
it's
don't know
full
if you have
screen,
made
sir.
it.
No,
Okay, thank you.
so for example, in a single injection procedure, we are using different kind of materials. For example, the syringe has different parts. The base is having a hard plastic, which is a hard polymer. Then we have a soft rubber, which is elastic material, elastic polymer. Then we have a transparent region so that we can see the drug which is carrying in the syringe. And next we have this gripper, which is connecting the syringe and to that of the needle. And we have a metallic pot, a metallic needle in it, and we have a drug in it. So each part of the syringe to the drug has a unique material inside it, which has a unique property it needs to do and unique application it is doing. World Health Organization has given a map such that from the birth to the final day of life, in one way or another way, we are associating with one kind of material or different kind of healthcare materials, starting from promoting health or like a healthcare system to prevent from any disease condition for treatment during any traumatic conditions or in need of a diseased condition, for the rehabilitation and palliation. We are associated with any kind of medical materials or medical devices in one way or another way. So to improve, materials can be used one for improvement of the quality of life or in case of a traumatic conditions. So what kind of materials we are presently using or widely using to improve the quality of life is mostly of drugs or healthcare products, or in case of any vitamin tablets we are using to increase the lifespan or to improve the quality of life. So either it can be taken as a in vivo, or like we are taking inside the body system, or we can use it in the external applications like using of glasses or contact lenses, like these kind of dental dentures, and this kind of ear implants, the external hearing aids, and this kind of oil based or sunscreen lotions and all. These are the things which are using used by the human system to improve the quality of life. These all comes under the medical materials device, and there are another types which are used for cured for a trauma condition, such that like implants which are using in the in vivo conditions, like during heart problem or a sudden heart attack and all, they will be using these kind of stents to remove the blockage in the arteries or veins, and during accidents or birth defects and all, they use these kind of implant materials like metals and polymer cast, so that we can restructure the face and we can look like a normal person. This will be very helpful for the people who are suffering from deformations and accidental cases and all. And sometimes during fractures also we can use this kind of implant, metallic implants, so that we can be a normal person with the aid of these medical materials. Okay. So sometimes not only metals, the polymers and all will also be used. Based on the need, we need to have the question like, what are the materials I am going to use, or what kind of treatments I can use for improvement of life or to treat a traumatic conditions. So the question is the first thing which will come, and there comes the answers. So the need for the questions from the patients or the needy people can be answered by starting from the researchers to the scientific people, and the companies who are making this device, and comes to the doctor so that it can directly go to the patient. So it is like a network where every person has some contributions to give a better life and to give a betterment of the society. Okay, so the understanding of these materials is not new, or the materials used for a human by the human people for the betterment of life is not new. Where it starts like before the 15,000 BC itself. We have some archaeological evidences such that this is the Egyptian Cairo tomb, which is made up of wood and leather. Wood and leather, okay, and we also have the evidences of a Peru skull closed with the gold. You can see the gold casting on the skull region, where they are using both the metal and the nature derived wood and leather for this kind of adjustments in the health region, or when in need of traumatic conditions and all. And in 600 BC, we have in India we have the evidences of nose replacement surgeries or nose reconstruction surgery, were done by Sushruta, who is called as a father of surgery. We know plastic is nothing but nose plastic surgery, which was done in 600 BC itself. And in the same duration, we also have archaeological evidences of using seashells, natural seashells, as a dental implants by the Mayans. Next, in the 300 BC, we have the archaeological evidences of using bronze as a leg covering region by the Roman. And after 1830 only, the starting or the evolution of the modern medicine came, where after the invention of urea by Justin von Liebig, accidentally in the laboratory condition, he gives a birth for the synthesis of organic molecules, and he quoted the word like organic materials are no longer belong to biological specimens around. We can synthesis in our laboratory condition. That was the word he quoted at that time. And after the invention of urea in the laboratory condition by this person, lot of pharmaceutical industries came, and they have developed organic molecules similar to biologicals like vitamins and analgesics tablets, antipyretic drugs, lot of biochemicals and biomolecules and pharmaceutical drugs and all came after the invention of the urea in the laboratory. And after 1830, there is a booming for the pharmaceutical synthesis products. Okay, and after that, after the pharmaceutical industry, there was a lagging period because of the war happening all around the world, and a lot of people suffering from injuries caused because of the war, and they lost their any kind of organ like leg or hand. They are suffering from so much of injuries and all. So to recover from these traumatic conditions and injury, they try to develop implants so that they can design an implant artificially, like how in ancient days they are using some other nature device for the adjustment or the losing part. They have developed some metal based or polymer based materials so that they can be used inside our human system, so to recover from the traumatic condition and be like a human system. Okay, so these are some of the evidences of the medical materials which are in ancient days, and how how the evolution of the medical materials is happening each year, each decade, or with respect to lifetime. Okay. And most of the time when I'm discussing materials or time, both by nature existing or synthesis conducting. Now after 19,000s and all, we are mostly thinking of the synthetic materials, because when you are using natural materials as such from the from any other human system or human transplantation or from animal system, there is a drawback of infection and drawback of contagious from one human system to another system, or one animal model to another human system. So most of the medical society are expecting to use synthesis materials. So in case of synthesis materials or materials as such can be categorized into three subdivisions. One is of metals, and second is of ceramics, and third is of polymers. It is how it is generally grouped. And in case of metals, metals will have this kind of examples like copper, steel, brass and all. And ceramic, it's similar to that of your material is it in the ceramic pot, porcelain, mud pots and all. And polymers like as such in the materials which is in plastic wares, toys kind of thing. And we can also use so much of materials which is in the interface of these region, like metal to polymer, we can use metal polymer composites, and ceramic to polymers, it is a ceramic polymer composites, and a metal to ceramic is a metal ceramic composite. Not only pure metals, we can also use composite materials to improve the property of the single material and for a better end product applications. Okay, so normally we categorize these metal ceramic polymers based on the crystal structure arrangements, where metal is mostly in the form of a well-ordered atom and basis. It is called the crystalline structure. Next, the polycrystalline is the next of crystalline, where it has a crystalline localized arrangement of crystalline, whereas the one crystal to another crystal has a gap of grain boundary between this. So one crystalline is in a multiple arrangement, so it is called as a polycrystalline arrangement. So most of your ceramics are in the case of the polycrystalline arrangement. And is the amorphous. Amorphous is a disordered arrangement of atoms in it. So generally we categorize materials based on the atomic arrangements only. However, when you are going for applications, this category needs to be go to the next step. So for application kind of thing, we need to understand the mechanical properties of this material so that it needs to withstand within our body system. So based on the atomic arrangement, it is called as a density, which is in the y-axis, and based on the mechanical strength, it is given in the modulus. So it is on the y-axis, density is on the x-axis. Okay, so if the material is lesser dense, then it is called as a light material. If it is of higher density, it is of heavy material. Similarly, if we increase the modulus of this material or the stiffness of this material, then it will be very stiff. And if it is a loosely packed and light material, light density material, then it is very flexible. So based on arrangement of atoms, atoms in a long range order, so you can see forms a higher porous structure. So it is very light and very flexible. Whereas you can see polymers have an intermediate density and it has a higher elastic property. So it is in the intermediate Young's modulus. Whereas in case of ceramics and metals, metals has having a densely packed crystal arrangement. So it is very heavy. Whereas ceramics, which is polycrystalline and also having a very stiff higher modulus, so it is very stiff. So this is the stiffness and heaviness is the basic slight difference between the ceramics and metals. Okay, so here most of the time when you are testing the medical materials or general materials, we usually test using this tensile property. You could see because of the higher stiffness, it is breaking at the minimum loading condition when it is loading in the perpendicular direction where the atoms are arranged. Whereas here you could see in case of metals, it is when you are pulling in the perpendicular direction, there is the elasticity and then only breaking is there. And so it can withstand up to a limited time, then only breaking is there. So next is the polymer, and you could see when a load is applied, you can see a lot of elongation here when in the y direction. So only it is having a elastic property and medium modulus. Okay, so by understanding this mechanical property, we can choose specific materials for devising different devising into a different structure and use it for a different medicinal applications. Okay. So in generally, the material used for biomedical applications in our human system, they will be called as biomaterials. The biomaterials may be natural or synthetic, so which can be, if you are using in an in vivo condition, it needs to be biocompatible as possible and it must not reject by our human system. So these are some of the examples of the plant materials or biomaterials which is currently in use, used by all over the world for treatment conditions and to improve the life quality of the human system. So it has all the metals and ceramics and polymer material in devising these kind of biomaterials. Okay, so In designing these materials, during scientific methods and research conditions and all, first you need about the hypothesis. Hypothesis is the outline concept, what I am going to do. For what need I am going to devise this material. That is called as hypothesis. For research methodological purposes, hypothesis is the first step for all the researchers need to start with. After designing the hypothesis, based on the research interest, it can be categorized as experimental work and that of the theoretical work. In experimental work, it starts with the synthesis condition based on the literature surveys and all, and next they go for optimizing parameters by altering the synthesis parameters, whether we can obtain the needed result which you are intended to get. And next is the synthesis confirmation, whether what I hypothesis material I am getting it or not. We need to confirm the suitable characterization techniques. Then the property analysis, whether I said like a mechanical property or optical property or electrochemical property, whether the hypothesis is tested or not, whether it is going to fulfill the need and all, we will be confirmed after the property analysis only. Then interpretation will be made. Similarly, in theoretical approach, they will start with choosing a structure based on literature survey or by designing a new model. Then they simulate the model based on the electronic structure arrangements, and they optimize the structure for a higher stabilization, and then they run the programming for simulation and also for optimization condition. They understand the property analysis based on the density of states and energy diagram, and there are so many software tools available to understand the different property analysis. Like mechanical property, there will be different software tools, and for understanding optical property, even for application kind of thing, there is a different software tool. They will run and simulate it in a theoretical networking, and they will understand the results and they will interpret. In most of the time, the property analysis of the experimental and theoretical needs to be compared, and they say sometimes in most of the abroad countries and all, they try to understand the theoretical concept, and after getting the results, they will try to simulate in the experimental part. Likewise, they will work out together in hand in hand. Both the experimental and theoretical person will share their knowledge, and they will devise a material based on the need and to fulfill any requirement for new devisings and all. Okay, so in the synthesis part, as I'm more interested about the experimental part, I go on with synthesis. Synthesis, here I am given solvent synthesis, not only solvent synthesis, a lot of physical and chemical methods are available. So these methods can be adopted for synthesizing the materials. So synthesizing materials can be from the natural source or also the synthetic source. And after synthesizing a material, we need to confirm using the characterization technique like I quoted here, based on the materials you are doing, you are synthesizing, whether it is crystalline or amorphous, or what you are going to confirm. You need to choose the characterization techniques based on the materials you are synthesizing, and you need to also choose the property which you are going to test for end application. The testings after confirming my material is formed with a higher purity, or I confirm this material as formed, we need to test with the in vitro and in vivo condition. In vitro condition is simulating in a lab, like our biological system simulating in the petri dish, or in a laboratory condition is called as in vitro, so that blood compatibility, cell compatibility, antibacterial efficacy can be tested. Then only it will be go for in vivo testing in animal model like mouse, rat, or genuine pig kind of model you need to choose for in vivo testing after suitability clearance. Then after passing these many tests only, a single material which is suggested for medical application will come for application, any kind of medical applications. It will become after testing and approved by this material. And there are a lot of procedures there for approving from testing to application. So for that, a systematic procedure need to be done. So for suggesting a material, first question will be that whether it is in a contact with body or non-contact with the body. If it is in a contact with body, no test for biocompatibility is required. Like how long, prolonged time you are in contact with the body is also different. If it is no contact, nowhere touching the body, no test is needed. Whereas if it is touching the body in vitro or in vivo condition, means then we need to characterize this material. So if the material in some way or another way, it is already registered in Food and Drug Administration, or it is already registered medical material means, then it also it is commercially available means, whether the property is similar, like already registered material and the new material is property is similar, then it can be go for a final review, and it is cleared for a product development. If the property is different means, then there is if there is a sufficient data is available of a new material and the earlier material structuring or any devising means, then it will go for a final review. If the material property is different, we don't have any sufficient data, then we go for a biocompatibility testing as per ISO 10993 standards. So this standard is very, very important for suggesting any materials for medical applications, both in vivo and in vitro. So this ISO is given by the name Biological Evaluation of Medical Devices. First test is the body contact, whether it is on the surface, external or implant application. We need to categorize the material based on this subdivision. If it is in body contact, based on the contact duration, whether it is limited to 24 hours or it is of a prolonged duration or it is kept as permanent like in case of the implant, then it will be categorized and it will be tested in different conditions, and then they will be studying the properties such as tensile, elongation, FTR kind of thing. Both the physical and chemical properties will be studied. Then it will come for the biological effects studies, where these basic studies are in vitro condition and the final will be of in vivo conditions. Like this, systematically they will be doing. They have particular standards like how much sample you need to take, how many studies you need to take for a simple device, like starting from the contact lenses to starting to dental implants. They have a particular standard. We need to follow the standard. Even for research paper writing also, it will be beneficial if you are using this protocol and testing this materials. It will be beneficial. Okay. And now I'm shifting to the next stage. I already told you we can use polymer, metals and ceramics for medical application. I just want to list you some of the polymers which is already used in the medical application, and what is the present trend and the future materials which you all need. So in polymer and biomedical applications, lot of suture wiring for connecting the cutting regions and all. They will be using suture wires made up of polymers, and lot of vascular tubes and connecting lamps and all. They are using this polymer material only. Why they are using this polymer material widely means because of the flexibility, and one more important property is that it is having a very good blood compatibility. It doesn't form any blood clot and doesn't form any thrombosis. The flowability is very good. Because of these advantages, recently lot of surface modification techniques and manufacturing techniques has came to use these biomedical polymers for a lot of application, starting from skin tissue repair, vascular grafts, scaffolds, drug delivery, and biosensor and diagnostic applications. Like that, we can change the polymer into different structuring and functionalization, and we can use it for different applications. Okay, this is the future and this is the present use in medical devices. Okay, and the next important subdivision of the polymer is hydrogels. This is also a booming topic of research, where hydrogel is nothing but it is in a gel-like structure which is having a lot of water accumulation in it, and the biocompatibility of this hydrogel is directly proportional how much amount of water it is accumulating without any leakage. Okay. These hydrogels, if I am saying water, the water can also be replaced with drugs or institute drugs or some other dermal ointments kind of thing. Also, we can load it in the hydrogel and we can use it for external and also for internal applications. Recently, most of the work is also on external. Future, they are thinking on a drug delivery system. So here, dermal drug delivery or wound dressing, contact lenses and everything. They are suggesting these hydrogels. And the next important subdivision of polymer is a biodegradable and bioresorbable materials, where will undergo resorption by the body system. Like usually they will say by the word fit and forget. Like if it is fits into the body system, we can forget altogether the material. The material will do its work and degrade by our body system without leaving any trace by our biological system. So this is also a current trend of polymer biomaterials, where it can also used for transdermal application, vaccine delivery, anti-cancer activity, ocular delivery, and the site-specific delivery. These are all future, whereas transdermal vaccine delivery are currently they are adopting this material. Okay. Next to the polymer, the important material I told you is the metallic material. Metallic material, if you saw the timeline of the evolution of these materials, metallic material is still there in the ancient times. So you could see a lot these metallic materials they are using for widely for hard replacement application where loading is needed at that region. Where this polymer will be very flexible and ceramics will be very brittle, it will be breakable. So where there is a loading is needed, this metal will give the support and withstand the load at that conditions. Okay, like hip, knee, shoulder and all, they will be using these metallic materials. And presently used in biomaterials mostly comes under the category of stainless steel, cobalt, titanium and alloys. Stainless steel was the first material widely used, then comes the cobalt based alloy, and presently they are widely using the titanium based materials. The story of the titanium based materials widely used for biomedical application starts with our Dr. APJ Abdul Kalam. I used to say one story. Once he was visiting a physically challenged school in Hyderabad, and he was seeing like lot of student is carrying heavy loaded knee external joints, and they couldn't able to stand and wish the president itself. And he was asking what is the reason for this and all. They are saying this is made up of stainless steel material, and it is weighing heavy compared to the weight of the individual person. So at the time, titanium was widely used in aerospace industries because of the lightweight, anti-corrosion property and all. And they were trusted. And after his suggestion, why can't we use that material for this application? So after his suggestion, he himself and his team of members in DRDO and they created a lot of medical implants similar to the stainless steel structure. He devised he and his group and the military officials, military doctors and the scientists, they developed dental implants, bone plants, titanium meshes and bone augmentation materials on this titanium based structure. And after that only in India a lot of companies started developing titanium based materials for medicinal applications. So these are some of the titanium based materials currently in use, like titanium dental implants, this titanium mesh. This is a hip implant having a lot of titanium structure. You could see not only titanium, they are also having, based on the structuring need, they are also using polymer and cobalt chromium alloys. Okay. And not only in heavy debasing, and even a small structure also plays a major role in application point of view, where this titanium can also load the radioactive source. This radioactive source can be used as a source for treating cancers. Like brachytherapy is a treatment for cancers, where higher radiation will be used for killing cancer cells in the nearby region. For that radioactive source coverage and all, also they are using this kind of small sized titanium seeds. And one important family member of the titanium is a nitinol. Nitinol has a combination of nickel and titanium in it, where it can regain its shape after heat and after pressure. You could see it is regaining its shape when it is dipping inside the water, and after pressure it is regaining its shape. Where we can use it for a medical application is during heart blocking and all, they will be using angiosurgery. So if they are implanted the small size stents inside the blocked region and all, you could see the blood flow is very normal inside the artery. So this is how they are keeping this stents made up of nitinol for the heart surgeries and all. Okay, so we saw about polymers and polymer family, we saw about titanium. And titanium, even though we are using metal and super properties of these metals and all, they are also having some drawback, like they have a lesser interaction with the nearby tissue, and a lot of failures is also there, which can be rectified by suitable coatings and all. The coatings mostly of the ceramics. Ceramics can also used for the coatings and also with the as such materials. So when we are saying as such material means, we need to understand about the generation of biomaterials. Okay, most of the metals are in the first generation materials. Okay, the first generation is starting from 1950 to 1970, where they are called as a bionet materials. So if we are saying bionet material means they just as such sitting and they are doing the function like keeping, and they don't have any interaction or they don't do any job to the nearby tissue. Okay, So they have or sometimes they will call it as a minimal interactive material. Okay, and the second generation materials, mostly of the bioactive materials and lesser of the bioresorbable materials, which has a ceramic part in it, where hydroxyapatite and some of the polymer also comes under these kind of bioactive materials. So in case of bioactive material, it means it is having an effect on the living organism. So you could see a minimal gap between these things, and there is a interaction on the surface, right? So it can talk with the nearby tissue and it can interact with the nearby tissue. So it can understand what it needs to be done at the situation, and however the interaction is very less. So it is called the bioactive materials. Okay, this is a second generation material. The second generation ends at 1990, and we are also using some part of second generation here. It is not like any, but it's little bit modification is there for the next generation. Okay. Next is the region for lesser bioactive and higher resorbable materials, where the nano plays a major role, and the composite, the era of composite also came, where we can hybrid within a metal and polymer or metal and a ceramic kind of thing, and we can do the different structure so that it can be resolved by the nearby region. So that you can see there is an interaction between this material, the center white material, which is the medical material, and nearby this is a tissue, means there is an interaction between there, and a layer is covered between this layer, means so this layer is formed because of the interaction between this material and to the nearby tissue. Not only this, if we are using complete degradable material, like in case of PLA, where you can see complete absorption of this material by the tissue, but by like engulfing, and it is like completely reacting to this material, and with period of time it will be converted to the native tissue itself. So that kind of natural absorbing comes under the third generation of material. And we are now looking into the fourth generation materials, where we are trying to understand the material as such, or trying to understand the tissue as such, and like to mimic the structure and functionality of this material, and wish to create the material as such, as similar to that of the tissue. Here also we are trying to involve the nanostructure materials, collagen, biomolecules, so that we can mimic the structure and functional components of this material, which is going to be the future. Okay, so when we are discussing more about the ceramics, in the ceramics I told you like first generation, second generation to third generation, like starting from pure to hybrids they are moving, where in the first generation there is alumina zirconia, second generation is the glass and glass ceramics. So most of the time we say glass, window glasses only we had that window glass, or abstract glass only we had that experience. How glass is using for medical application is glass is amorphous structure, whereas the glass ceramic has a amorphous combination of the crystalline arrangement. Because of crystalline arrangement, it gains its resorbability property, and it can also has the capacity to form a native bone formation with respect to the period of in vivo or in vitro immersions. Then is the era for now we are in the era of the third generation materials, where we are trying to understand like more talk to the nearby tissue, and in case of the structure and functionality we are trying to create three-dimensional structures in the third generation of materials. So in place of ceramics, I already told you, more importance is given for polycrystalline materials, and little importance for amorphous materials, where polycrystalline will give the strength of this material, and also another advantage of ceramic materials, from the simple powder we can draw into a different shapes, like in a powder or three-dimensional scaffold or for coatings. Likewise, we can design it into different structure, and without losing its biological or any kind of physical chemical properties. That is a greater advantage of ceramic material. So only it is widely used for a lot of biomedical application, different shapes and structures. Okay. So another greater advantage of this kind of ceramics is, so you could see x-axis is the implantation time, y-axis is the percentage of interfacial with the bone tissue. You could see here type 1 and type 2 materials or a bioinert materials, where we are shifting from bioinert to bioactive materials to bioresorbable materials. You could see that within the implantation time of 10 days, it is creating a suitable bond with that of the bone tissue, nearby tissue, so that if, for example, if after surgery kind of thing, if the patient is taking 3 months to 4 months recovery time as per the conventional time, the patient can recover within 10 days if you are using these kind of material, this generation 4 bioresorbable materials. Okay. So this is why these materials are using means it actually talk with the native environment and create the mimetic tissue at the surface of these materials. And this is the evidence both by experimental and theoretical way. You could see this is the bioactive glass into the bone tissue. There is intermediate bonding which mimics the bone-like structure is forming, and this is the greater advantages of this fourth generation material. Not only to bone, it can also, I already told you, ceramic can be shaped into different structure and forms, right? So this is one suitable example that sensor in having this kind of bioactive powders and all, where you can use it for or a dental cavity filling and tooth regenerations and all. One of our work of these bioactive glasses has been recognized widely. My work along with my PhD guide Balkumar sir, where we done a work on strontium bioactive glasses, where we have proven that this material is covering these cavities and it is having antibacterial efficacy of this material within 1 day. And it is having a good regenerative regeneration properties. And simple another beautiful thing in playing with the materials is one simple material we can devise into different structure. Here we are using it in a powder form. The same kind of biomaterials, when it is hybrided with or composited with the polymer, we actually use it for a bone application. I already told you biomimetic is a next generation material applications, where you could see where I am tuning the chemistry of this compound, synthesis compounds, and I can actually tune the porosity, interconnectivity, and even mechanical property also can be tuned. And this is the scaffold which I have done in the laboratory condition, and this is a bone. You can see the mimetic structure of the scaffold into the bone. So, and not only this hard material and that of the powder, we can also drawn into different shapes where we can use it for a tissue regeneration, surface skin tissue regeneration, where we adopted the electrospinning technique, where bioactive materials has been prepared in the formation of gels, and the gels has been drawn using this electrospinning method, where you can make into this kind of sheet-like structure. This the novelty of this material is the sheet-like structure not only looks like a fiber, in the cross section of this fiber you could see a lot of hollow fibers, and in the hollow fibers we can actually load the drug, and it has a drug loading efficacy, so that when you are placing in the transdermal applications, it actually give drug releasing at the in situ region, and the curing rate will be very quick. Okay, and not only this bioactive glasses, pure material, we can also hybrid with collagen and mimic the structure more of a structural and functional way, so that you can see this is a structural function similarity with respect to skin three-dimensional architecture of this material with the porous structure, and also we intermediate fiber arrangement. And this material is proven to be of a good hemocompatible, and it is having good angiogenic property which is tested in chicken embryo, and it is having a good biomimetic property. Okay, next is this is all about like most of materials used for in vitro and mostly of in vivo testing. What about testing any diseases in a previous state? So that is one part of betterment of life, right? So data world is a present slogan, like a lot of data sciences and artificial intelligence are coming to era, and the future is going to be a data science. Okay, so we want to monitor our health condition day by day or minute by minute, and we have for that we are devising a lot of sensor devices so that we can monitor our health accordingly. So you can see we already have a glucose monitor in our home, and we have presently, because of this COVID situation, we can have a pulse oximeter in our home, and we can have a thermometer in our home. Like these are small sensor devices. So we have these watches and all, now they are monitoring the blood pressure, calorie burnt and all, right? So these are some of the biosensors. When in